Tell us about yourself. Briefly describe your professional interest and experiences.
My name is Sebastian Serrato. Um, I come from a medical background where I started to be a PCT with the Boca Raton Regional Hospital um, about 6 years ago. I was a PCT, telemetry monitor tech, and a HOC, that is the unit secretary. I normally will be placing orders, or like orders that they needed to be placed. It was the old system, so normally they were written, uh, and a majority of calls and all that applications that you had to do as a secretary. Then I was a PCT also. That is just a helper for the person that is the assistant of actually the nurse. After that, then became a telemetry monitor tech. That is the person that actually monitors and interprets AKGs. Then I came to Texas and I started working at uh, uh, Baylor Medical Center at Grapevine, which is centralized monitor. So we were watching over 60 patients there per person and having an interpretation on AKG. After that, then I went to the pediatrics. That's been over 3 years now. Actually, no, this is my third year. Went over pediatrics and I started doing the same thing, interpretation of AKGs and monitoring. I had experience at Cooks and Children's Medical Center Dallas. Right now, my current job is at Medical Center Dallas. Children's Medical Center Dallas, and Cooks I worked for half a year when they were creating their cardiac unit. Um, Normally at Children's there's more education, so I actually teach medical students up to fellowship level. Um, the Then I transitioned to be um, a nurse student, and that's when I'm actually trying to go with my interest. I wanna actually do certain cardiac nursing uh, in your organization. So that's where I come from. I have experience in cardiac, so that's where actually is my interest in nursing.
Where do you see yourself in your career in 5 to 10 years? What are your long term career goals?
Uh, I see myself in 5 to 10 years probably being a cardiac nurse in a critical unit in the pediatric population. That's my goal in the long term. Even though if I need to actually escalate, progress little by little in my experience. So as much as I get experience on maybe a telemetry unit or um, or monitoring unit that has to be with cardiology, then I can go to maybe a CVICU, and that's my goal in the long term um, for actually my career as a nurse.
What previous job was the most satisfying and why?
I believe the most satisfying job that I ever have is being a monitor technician in a pediatric population. And currently, I think that the most satisfying job is the one that I have right now. That is a telemetry monitor tech at Children's Medical Center. The most satisfying part about it is you being an advocate for the patient. Um, while you read AKGs, there's a lot of mm, staff involved, medical uh, doctors and cardiologists, and the best part is that at certain points I have to be an advocate for patients. Uh, for example, I have a patient that had an A flutter rhythm, and they were calling in ATAC for the last 24 hours. And by being an advocate to that patient, I was able to identify that it was misdiagnosed, and after that, and after I specified to the cardiologist that it was actually another rhythm and another diagnosis, they actually change all the plan of care for the kid, and they actually decide to send him to the ER to cardiovert. I mean, to the OR to cardiovert, which it makes me feel that I am helping the the patient for the best, and maybe decrease the risk of doing something uh, that was wrong. Uh, so it makes me feel good that I can help to actually improve patient care.
Talk to us about the value of teamwork. What did you do in your last job, internship, or school to contribute towards teamwork in an environment?
I think teamwork is the most important thing in the healthcare, in the clinical setting. Um, there's interdisciplinary teams that you have the respiratory therapies, you have the nurse, doctors. There's different people that has to come together and match and just work like a really synchronized clock to be able to achieve a goal towards a patient. Um, at my job at Children's Medical Center, we developed different strategies, and what at a certain point I was able to lead um, a team and be able to increase education in nurses by creating um, monthly educational flyer, and even a PowerPoint exposition that they will actually put in their screens at the time that the nurses were taking their breaks. Um, they actually the actual result of that was that the nurse were able to um, interpret or actually see in their patient monitors a lethal rhythm in less time than they used to do.
Please describe a situation that required you to complete a number of things at the same time. How did you decide what was most important? What was the result?
As a monitor tech in children's hospital, there's been a different times that I had to complete different tasks, like check orders and monitor actually the screens, so there's no any changes. That's one of our priorities to be there. Even talk with doctors that require help with doing different interpretations of 15 leads AKG for this population, that is the pediatric. Um, we have to do stat AKGs at night, which is my actually shift at work. And um, in all those tasks you have to do, there's always have to be a priority. So there's been times that there's have stat AKGs that I have to do, and we need to check what's more important for our unit at that moment. We have actually patients that needed an AKG that the kid was actually not doing good in different floors in the hospital, but I have to delegate that to a different unit. So because we have older kids in our unit that are not doing good, and that will take more staff to take away from that for the patients to actually care, and it's that priority of actually what it's less risk for actually patient is majority of the times that I have to do in the at work. So majority of the times is just to be able to identify and notify uh, changes in events that are more important than 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 other tasks. Um, one of the actually results of that is um, the right communication that we have if and how to escalate it if it's something that we need to actually call a code, or we have to actually just notify the nurse, or something that is that important that you can call directly the doctor, so it can be treated as soon as possible.